This is Crohn's and Colitis Foundation Perspectives on ReachMD. The following episode is brought to you by the Crohn's and Colitis Foundation and the American Gastroenterological Association.
I'm Alesandro Fichera. I'm a colon and rectal surgeon from University of North Carolina, and with me I have my co-moderator, Judy Cho from Mount Sinai, New York. We just co-moderated a session on management of complicated inflammatory bowel disease. I want to jump right into the question, Judy, and ask you what was the takeaway message from that session from you?
So the major takeaway for me is it's an exciting time in the management of Crohn's disease. We have two major new class of agents, ustekinumab as well as vedolizumab, in addition to the long-standing anti-TNF agents. So the major unanswered question, and I think it's a very exciting question moving forward, are do these different class of agents have different efficacy in being able to prevent the stricturing Crohn's disease, which is one of the major complications that lead to patients having to need a CU.
So from the surgical point of view, you brought it up already. We are getting patients that are different from patients in the past, and they may be more prone to complication or not. We really don't know. And working together with you guys, trying to answer these questions and to do surgery at the right time, I think is critical moving forward for the management of these very complicated patients. The other question I want to ask Judy is, so what advice would you give a clinician when they go home, how to implement the lessons or the new development and improvement that they will learn today, how to implement that in their clinical practice?
What's clear now is that there are very substantial long-term benefits to achieving complete mucosal healing, treating to targets as opposed to symptoms. It's unclear which one of those biologic agents may work in which patients, but I think the data are quite clear now that the goal is to go for not just remission, but deep remission.
This is all the time we have. Thank you, Judy, for joining me and discussing the findings and the discussion we had at this very exciting session, management of complicated inflammatory bowel disease. Thank you very much.
You've been listening to Crohn's and Colitis Foundation Perspectives. To access other episodes of this series, visit reachmd.com/foundation, where you can be part of the knowledge.